realized now I'm speaking from my vocal cords, throat, and you all are listening from your ear. Imagine if I have problem with my throat. Imagine, God forbid, you have problem with your ears. It might be challenging tasks. So where we go? Right, we go to ENT specialists, ear, nose, and throat specialists. And now, good morning, good afternoon, good evening. As per the time zone you are watching this video, I'm your host, Dr. Sumant Mishra. In our show, Positive India, Aapka Dr. Bhaiya, we have a special eminent guest, ENT specialist, Professor Dr. Shalabh Rastogi Ji, who is a senior consultant and head ENT, Tata Motors Hospital, Jamshedpur. Welcome, sir.
Thank you, Dr. Sumant. Thanks a lot. It's my privilege to be here.
We are privileged to have you here, and we welcome our viewers on this show. And Dr. Shalabh will enlighten us, our viewers, with a lot of unknown entities about ear, nose, and throat ENT issues. And before we start, let you know, all our viewers, Dr. Shalabh Rastogi was a very academically talented personality, graduated from Maulana Azad Medical College, prestigious, and then later on went to UCMS, University College Medicine Sciences, and did a lot of activities, many research papers, publications. Now he is a senior consultant and head of ENT in Tata Motors Hospital. And now let us start with the question and answer sessions for our viewers. What does an ENT? Yes, please.
Thank you, Dr. Sumant, and special thanks to all the viewers. Because of you people, I got to meet Dr. Sumant, and you must tell your viewers that we were in the same medical college and we were friends,
Yeah.
and more than that, we shared the room also. We were the roommates also.
Yeah, excellent. So we have nice history way back during our bachelor studies when we were together. We were playing together. We were eating together in the mess hostel, and we were also in the universities in the different classes. So now coming back to the questions, Dr. Shalabh Ji.
Yes, right. Please go
What
ahead.
does an ENT specialist do? Would you like to elaborate to our viewers, and what type of conditions do they treat? Please.
Yes. ENT ENT is a short form for otorhinolaryngologist, and ENT stands for ear, nose, throat. So ear, nose, throat doctors see all the ailments and disorders of ear, nose, and throat, and it's a recent branch as compared to medicine, surgery, and other branches. So lots of people are still not very much aware about the ENT, and what we can say that it's a very evolving branch, and because of that, we people not only see the disorders of ear, nose, and throat, but we also venture in head and neck. We also venture in skull-base surgery, and we are also vertigo specialists.
So excellent. Here we liaise together. We as dentists and oral maxillofacial surgeons also liaise with ENT surgeons, especially when I was in Scotland. We were also covering ENT during weekend emergency duties, and we were doing epistaxis and like some foreign body in throat and all those ear infections. So there we liaise, and also in the surgical operation theaters, we were liaising together. So now, how can someone differentiate between a common cold and sinus infection? So you have seen many of us get sinus issues, sinus problems, sinus infections, but they think it's a common cold, and then they keep procrastinating, delaying the treatment. Ultimately, they realize it's not is something related to sinus. So, can you please enlighten our viewers how to differentiate?
It's
Thank you.
very interesting question, Sumant. Basically, it's a common myth that all the cough and colds are common cold. So, the basic difference between the common cold and the chronic sinusitis is that common colds resolves in 7 days, whether you take the treatment or do not take the treatment. It's a self-limiting disease, and it's a common thing that if you take the treatment, if you do not take the treatment, you get up in 1 week, and if you take the treatment, you get better in 7 days. So it's more or less same thing. But uh, chronic sinusitis is a complication or a sequelae of the common cold, in which you get the infection in the sinuses and the symptoms keeps on persisting for long and long. And the symptoms are not very much acute, but they are very ongoing type of symptoms. So patient neither feels that he is totally all right, nor feels very much bad that he is not at all okay to continue his daily activity. So that's the reason why people basically procrastinate for going to the doctor for the chronic sinusitis. But message to all the viewer that if you are suffering from cold-like symptoms like nasal congestion, uh, sneezing, itchiness in the nose, post-nasal drip, continuous mucus coming in the nose, then you should visit a ENT doctor.
So, never procrastinate, don't delay. Contact Dr. Shalabh Rastogi Ji as soon as possible, the ENT surgeon. Now, on a
Right.
lighter side, let us go back to the hostel days. Dr. Shalabh Rastogi was excellent in academics, but not only that, he was equally excellent in the sports activities. When you don't find him in the reading room, library room, you find him in the old boys hostel, either TT table tennis, playing table tennis or badminton. And also in the cricket field, he was very much effervescent, always enthusiastic, always motivating the colleagues, and also being an active player as well. Now, coming to the next question, from the nose we move the sinus, we move to the ear now. What do you think? Many of us have things like, I cannot hear properly. So what are the causes, symptoms of common hearing loss?
Right. So it's a very important question. Hearing loss basically is inability to hear properly, right? And it, it comes either very suddenly, then it is called the sudden sensorineural hearing loss, or it comes very gradually. So people basically tends to ignore these things, and it's not like that it's a one all or none phenomena that we are not able to listen anything. But most of the time it's a keep on increasing and increasing. So whenever you feel that you want to listen media or television at a louder voice than your other persons in the home or group, and whenever you keep on repeating, asking for the repeat of the statements, then you should get yourself checked for the hearing. And this test is very simple, and it can be done in just 10 to 15 minutes. It's a test called audiometry, where you can go to any ENT specialist or the audiology clinic and get yourself checked for your hearing.
So thank you very
So,
much for these informations to our viewers. So definitely our viewers will go, if any issues, go the soon as possible to the ENT specialist or the audiology clinic. Now, Dr. Shalabh Ji is also active in social philanthropic activities, and he's doing a lot of philanthropic activities, social causes in school health programs. So Would you like to briefly tell something about your school health programs?
Yes, basically, just now I told you the about the hearing loss and the ENT other things. So this is the same thing we do here in our schools. Basically, I like to meet my people and the community beyond the boundary of hospital, and there's always a step ahead. Than you want to go one step ahead than the disease, and that is the preventive thing. So
Excellent.
we want to raise awareness in the school so that many children get aware about their hearing loss. It tends to come early so that we can make them as fit as possible for to do any sort of job for their future.
Great cause for the
Many a
future.
times, many a times people tends to neglect all these things, and later on it becomes difficult for ENT surgeons to basically correct all those things because some of the things are irreversible. So it's always better to get aware of all these things and get to the correct person at the right time.
Excellent. Well said. Awareness is very important. Awareness leads to prevention, and prevention is better always to avoid in the late stages. Now, we already discussed about the nose sinuses. We discussed about the hearing loss ear. Now we are talking about the throat. Can you please explain some of the common causes and treatments of chronic sore throat or tonsillitis?
Yeah. Now the tonsillitis and sore throat are not synonymous. So basically, sore throat is a general term whenever you have a problem in your throat, and it can be caused by viral infection or the bacterial infection. And usually, it's a self-limiting disease. But at times, if it is because of bacterial, then you have to give antibiotics. As compared to that, tonsil is a specific organ in a specific part of the throat, and it's a lymphoid organ. And whenever you have infection to specifically to tonsils only, then you say it as a acute tonsillitis or a chronic tonsillitis. And the treatment for this is either medication, or if it happens quite frequently and disturbs the daily routine of the patient, cause absenteeism in the school as well as at the work place, then we might have to go for the tonsillectomy, in which we remove the tonsils.
Excellent. Well said. Now, again, talking about the nose paranasal sinuses, what are some of the triggering factors and the treatment options for allergies affecting the nose and the sinuses?
Right. So allergic rhinitis is a very known term, and it's an allergic reaction to the nose and the sinuses, and it's very rampant and very much increasing in our country. And the prevalence is around every fifth person is suffering from allergic rhinitis, and probably at your place also it must be on increase because it increase in incidence is directly related to the industrialization and the activities which we are doing nowadays. So allergy can happen because of allergens. Allergens are the proteinaceous particles which are found in the environment either indoor or outdoor. So some of the examples of the indoor allergens are dust mites, dust particles, smoke, and denders of the pet, fungal spores, so molds. So and some of the example of the outdoor allergens are your pollution, your pollens. You must have heard about the hay fever. So pollens are major allergens, and these are called, because of this, patient might suffer from the seasonal type of allergic rhinitis. There's another term called as a perennial allergic rhinitis, in which the symptoms persist throughout the years. So the basic treatment, the first coming to the symptom. The symptoms are acute attacks of episodes of sneezing, nasal itching, nasal discharge, and nasal obstruction. Patient is
Okay.
absolutely normal at one time, and within few hours, patient complains of so much of cold that he cannot continue his daily routine. So
Yeah.
the treatment option, as with any allergic reaction, is first is a prime is a prevention. You tend to identify your allergens, avoid all those allergens. So in general, we say to our allergic patient that you do not come in contact with aerosols, dust, and strong smell materials. Wherever you go, you wear a mask. Second line of treatment is medication, either in the form of tablets or in the form of intranasal steroids. There is a pumps with a medication, and you basically pump it inside your nasal cavity. Surgery and other modalities come later. So in general, if you are suffering from daily attacks of sneezing, rhinorrhea, and nasal obstruction, then you might be suffering from the allergic rhinitis, and it's better you get in contact with either an allergic specialist or a ENT surgeon so that they can help you out in resuming your normal activities.
Excellent. Nicely explained. Now, we all know about the hygiene, hygiene of the body. I, being an oral surgeon, basically a dentist, I talk about oral hygiene, brushing techniques, brushing, tongue cleaning, all those things. How about the ear hygiene? We have seen a lot of people using cotton swabs to clean the ear. Now, let us have specialist intake by Dr. Shalabh Ji. How can you explain the importance of proper ear hygiene and the potential risks associated with the cotton swabs?
So this is another myth, and I want to clarify this thing that these cotton buds are should not be used. We, as a medical person, always advise not to use all these cotton tips. The reason being, ear is a self-cleansing organ, and majority of the time, patient do not require any cleaning. God has given a protective material called cerumen, or we can generally call it as a wax. It forms a layer in over the skin of the ear canal, and it protects it from bacteria and other particles. So, in some patient, these wax or cerumen got collected, and that
Yeah,
too because we basically put the earbuds and push it inside. The,
all
I
right.
am again reiterating that ear is a self-cleansing organ, and it does not require any intervention from any person. Basically, we, while cleaning, makes many may cause trauma to the ear and leads to the infections of the ear. I
So you
generally
mean to say,
tell to my
yeah.
yeah, I generally tell to my patients jokingly that see, you have eyes, you have nose, you have mouth in front of you so that you can see it in the mirror. But God has given ear at such a place that you cannot see it by any means. So just leave it alone and it will not trouble you.
So basically, Dr. Shalabh Ji, you wanted to say that the wax natural protective mechanisms, they will be cleansed automatically, or they will,
Automatically.
we don't have to clean
They,
anything like this. Use.
yes, they can be cleansed automatically, and most of the time it get collected in the ear, and you have to just clean this part of the ear with a
So you
soft
mean to
cotton
say you
or
are
soft cotton.
talking against this industry? They will be totally
Yes, I hate all these. These are the biggest enemy of ENT surgeons.
wow. Those industries
You
will be
don't, you
totally,
don't believe, you don't believe, Suman, that many patient comes with a perforated eardrums because of while
yeah,
using all these. So
yeah. Good
these
point.
are all very dangerous things, and we never ask patients to use all these things.
Excellent information. Now get rid of the cotton buds, cotton swabs. Thank you very much, Dr. Shalabh Ji, for this enlightening our viewers. Now, talking about the throat or voice issues, what do you think are some of the warning signs or symptoms of throat or voice problems that should be looked by an ENT specialist like you?
Yes. So another very important question, Sumant. And since uh, what should I say, that voice is an important part for our profession, or for in fact for socializing also. So we should take care of our voice, and we should take it very seriously. So two, 3 points which everybody should do is, if you are a voice user, suppose you are in a profession like teaching, you are a singer, you are a political person where you have to interact too much with the persons, peoples, then
Yeah.
so one should not indulge in all such type of practices. Second
All
thing
right.
I want to stress upon is, if you any change in voice that persists for more than 3 weeks, then it warrants a checkup by ENT
Oh,
person. So we have to look for the vocal cords, and especially if you are above 50, then the chances of having malignancies are also there. So one should not procrastinate what you said in going to the ENT surgeon if you have a change in character of voice for more than 3 weeks.
you got the message, our viewers. Don't shout and contact the ENT specialist as soon as possible. Now, talking about carcinomas, cancers, we always deal with head and neck cancers being a dentist. We have a lot of pre-malignant lesions as well in the mouth. What do you think as an ENT surgeon? Can you please kindly discuss the importance, emphasis of early detection and treatment of head and neck cancers?
Yes, sure, Dr. Sumant. Cancers, as we all know, are a group of cells which does not obey the normal regulation or regulatory rules of the body. So they keep on increasing and increasing, and whatever comes in their way and their surroundings, they basically invade and destroy all those things. So one should be very much aware of this type of disease, and the early signs regarding the head and neck, since all the major structures are very closely related in head and neck area, your brain, your eyes, your ear, mouth, all the cranial nerves, great vessels. So all these are in very close proximity. So any cancer which develops and infiltrate the normal boundary can cause its tremendous amount of morbidity and mortality quite early. So detection of head and neck cancer should be done early to get the proper treatment and to get maximum benefit of the treatment. So the early lesions which can be detected by a person themselves are change in color of mucosa, any white lesion, any red lesion, non-healing ulcer in the mouth, regarding any lumps and bumps in the head and neck area. So weight reduction, blood coming out from any nostril as well as your mouth. So all these are the warning and the red flags symptoms. So one, if a patient is suffering from any of the thing, then do not afraid. Just go to your ENT surgeon, and they will take care of all these things. They will check all the things and give you the early treatment, whatever can be best for you.
Thank you, Dr. Shalabh, for such a nice, insightful view. Now, dear viewers, kindly look for the red flags which our Dr. Shalabh Ji told us. And coming to the final question of the session, I, being a pediatric dentist, deal with children less than 6 years of age. And our clinic, we don't have GA facilities. So we do all the treatments under local anesthesia. For sure, 4 years, 3 years, baby, throughout the procedure, he or she will cry. They are shrieking at times. It's going shrill voice inside. Sometimes I feel my tympanic membrane vibrating for a continuous phase because we take almost half an hour per patient on an average, 30 minutes, shrill, shrieking. Now, for those individuals who have their occupational hazards like this, with due respect, no offenses meant, and they are dealing in loud environments, what do you think? What do you suggest about preventing noise induced hearing loss and how to protect their ears from damage?
Right, Sumant. So very interesting question and very close to my heart also. I'm
Excellent.
working in Tata Motors Hospital, and it's being parented by Tata Motors Limited. So Tata Motors Limited is a production company. So lots of machinery, heavy machinery, and with lots of heavy noise. So we do have a plan awareness drive for the noise-induced hearing loss, and we have launched a program for hearing conservation.
Yes, Dr. Saab, you're talking about noise induced hearing loss.
Yes, basically I was talking about noise-induced hearing loss. So it's a irreversible thing if it happens, but it is preventable also. So any area in which you have to increase your sound to be heard is a dangerous environment, is a hazardous environment. That means the noise level is too much, and you should not be there for in that environment for long without taking any protective precautions, or you use personal protective equipment for preventing yourself from getting your ear damaged. So the personal protective equipment which are available are earplugs and ear muffs, which cover your ear and reduce the sound level to a level which is non uh, dangerous for your ear.
Detrimental to the.
So you
Excellent.
must be noticing also that whenever you are using earphones also, nowadays,
Yeah.
previously it was not there, but nowadays after a certain level, you get a warning signal
It's
that
message.
loud noise.
Words.
So that is also because patients do hear earphones for long time. So in general, any area in which you have to raise your voice to be heard, that area is dangerous for you. If you remain there and if you are working in an area in which you have to do all these things, then it is always better to use hearing protective equipment, sir.
Dr. Shalabh, I was thinking we end that with the final question, but now I've seen the way you explain as like a professor. Of course, you have teaching experience, teaching faculty many. So now I'm my curious mind starts thinking about the protocols you made in the COVID, or what was the implications, because COVID-19 was the most challenging phase throughout the world. How ENT surgeons, ENT also very high prone, like you were corona warriors. So what was the implications on ENT of the COVID?
Yes, Dr. Sumant, it reminds me of very horrendous time when there was COVID all around. And we have developed our practice in a very innovative way, in which we never stopped during the COVID time also. We kept on seeing the patients. Though ENT surgeons are in very much risk area, because the COVID virus remain there in nose and the throat, and we always ask our patient to open mouth and exhale. So, but yes, post COVID, uh, the main symptoms which we are seeing in the patients are: one is a loss of olfaction, that is a loss of smell, and loss of and affection of inner ear, in which you have sudden sensorineural hearing loss. Patient was hearing normally, and within a few hours, patient hearing drops down to almost zero. So, a special mention to that thing also, that it becomes very difficult for patient to basically explain themselves that previously 3 hours back I was hearing normally, and within 3 to 4 hours I am hearing very less. So do not ignore that symptoms. It's a medical emergency, and ENT. If you go to ENT surgeon, they will start some medication, and if that medication
Okay.
starts within 24 hours, then the chances of regaining your hearing are quite good. So yes, post-COVID, we experience two main symptoms. One is loss of sense of olfaction or smell, and second is inner ear affection in the form of sensorineural hearing loss and vertigo.
Thank you very much for the extensive discourse, enlightening our viewers and many of the dispelling the misconceptions, myths as well surrounding the ENT. Now, final message to all our viewers from Dr. Shalabh Ji.
Yes, the few things I want to enumerate also to all the viewers, that ear, nose, throat, when they are working normally, gives you a pleasant life, but their absence will tell you the value of these things. So one should recognize the early symptoms by which ear, nose, throat problems comes, and when they recognize all these things, then only they can go to ENT surgeon. So ear problems comes with hearing loss, any sort of. If it is sudden, then you have to rush. If it is progressive, then also you should take your time out and go to ENT surgeon. Other symptoms of ear disorder are ear discharge. Anything coming out of ear is usually abnormal. So one should go and get it checked. And third symptoms for the ear is vertigo. Any spinning sensation you feel, then you should also visit to ENT surgeon. Regarding nose, the common symptoms are anosmia, that is loss of sense of smell, repeated clearing of the nose, nasal discharge, bouts of sneezing, and nasal obstruction. You tend to avoid breathing from nose. You open your mouth and start breathing. And one of the important symptom is snoring. If you snore a lot, then also you should visit ENT surgeon to get your airway checked. Regarding throat, any discomfort during eating, any problem in speaking, and any foul smelling breath or any blood stained discharge from the mouth, then all these are the symptoms for the problem of throat. Then you should go and get yourself checked. It's always better to be early than late, and then repent.
Always early to be, always prevention is better than early diagnosis. Thank you very much, Dr. Shalabh Rastogi Ji, for your extensive discourse, extensive coverage of the ENT issues, commonly involved ENT issues. And our viewers, thank you very much for being here with our senior consultant and head ENT, Dr. Shalabh Rastogi Ji from Tata Motors Hospital. Dr. Shalabh, thank you very much. I really express gratitude on behalf of my team as well as our viewers. Thank you very much.
Thank you, Sumant, and namaskar to all the viewers. And Sumant, I love your energy. Keep it up.
Thank you and namaskar to you all, and we all love you. Thank you.